Characteristics of a beautiful female infragluteal fold. With a growing demand for procedures aimed at enhancing the female body profile, particularly those targeting the gluteal region, liposculpture, gluteoplasty, and the Brazilian butt lift, there is renewed interest in practical morphological reference points that can support aesthetic analysis and preoperative planning. Although beauty cannot be reduced to a single formula, an aesthetically pleasing female buttock is commonly perceived as the product of a near-geometric, harmonious balance among shape, volume, and projection. From our review of a broad spectrum of images and body types, we have repeatedly noted a simple geometric pattern that may be useful as a conceptual guide. Specifically, the outline of an aesthetically pleasing female buttock can often be inscribed within an ovoid whose major axis is oriented at approximately 50 degrees relative to the vertical. The tangent to its inferomedial border, corresponding to the infragluteal crease, also forms an angle of about 50 degrees with the vertical. Together with its contralateral counterpart, this configuration creates an upward-pointing arrow, which we hypothesize may act as a pre-attentive visual cue directing attention toward the genital region. Based on this concept, we suggest two practical clinical landmarks. The infragluteal fold should be oriented at approximately 50 degrees relative to the vertical midline and should remain within the medial half of the posterior thigh, without extending beyond the lateral margin of the semitendinosus insertion. Importantly, these observations fit within the broader framework described extensively by Mendieta and Sood and Mendieta and Stuzen, whose widely used approach to gluteal contouring is grounded in careful evaluation of frame type, gluteal muscle morphology, and the relationship between skeletal frame and soft tissues, with practical implications for aesthetic analysis, preoperative markings, and augmentation strategy. The characteristics we emphasize are most consistent with the A-shaped, heart-shaped buttock, which is frequently perceived as aesthetically desirable. This viewpoint has clear limitations. The proposed geometric constructs are not presented as universal norms, but as a recurring visual heuristic derived from aesthetic observation. Aesthetic judgments are intrinsically influenced by cultural context and individual preference. Future work should test these concepts using quantitative morphometric analysis and correlation with patient-reported outcomes. Finally, the suggestion that the arrow configuration unconsciously directs attention toward the genital region ould be evaluated through translational studies in neuroaesthetics and visual neuroscience. Characteristics of a beautiful